Good day, everyone. I am Dr. Chua, and I am here to share with you the role of ICT in educational leadership. ICT has fundamentally transformed the delivery, management, and planning of healthcare services. In this context, educational leadership has evolved into e leadership, defined as a process of social influence where leaders and followers participate through technology to inform and be informed. In the health professions, this transition is no longer optional. Leaders are now responsible for managing complex health information technologies to ensure safe, efficient, and patient centered care. Successful technology integration in health education depends on specific leadership behaviors and personal qualities. Research in medical education shows that transformational leadership significantly increases technology adoption. When combined with supportive leadership, the effectiveness of technology integration is maximized. Transformational leadership hence play a big role in the digital evolution of medical education by acting as a catalyst for innovation and cultural change. The primary way transformational leadership influences technology integration is through the establishment of a clear, innovative vision. Leaders in medical education institutions who exhibit transformational traits are essential for setting the tone for change. These leaders inspire both staff and students to move away from traditional methods and adopt new technological tools. This strategic vision is a key attribute of effective digital leaders in the health professions. Transformational leadership also significantly and positively influences technology integration by motivating teams to embrace digital transformation. Rather than simply imposing new systems, transformational leaders encourage experimentation, provides good role modeling, and enables intellectual stimulation. Research indicates that the interaction between transformational vision and supportive management further increases the overall effectiveness of technology integration. Transformational leaders recognize the need for formal education in informatics and support proactive training initiatives to ensure that technological tools are implemented successfully within the curriculum. Effective leadership drives technology adoption, which subsequently leads to more flexible and responsive curriculum designs. By aligning technological advancements with health promotion strategies and industry needs, transformational leaders ensure that integration translates into improved student competency and workforce readiness. Effective digital leaders in health professions possess three categories of attributes. Social attributes focuses on the leader's ability to navigate interpersonal and professional networks. It includes social intelligence, the active promotion of diversity, and networking intelligence. Next is strategic attributes, which involve the leader's capacity for long term planning and technological foresight. Key components include an innovative vision, digital intelligence, adaptability, and the utilization of a flexible leadership style. Personal attributes relates to the internal qualities and mindset required to lead digital transformation. It encompasses motivation, role modeling, openness, self-awareness, agility, and a willingness to engage in learning through errors. Educational institutions can utilize these identified attributes to inform targeted training in programs and assist in the strategic selection of leaders to drive digital transformation within their organizations. Using Bowman and Deal's four frames models, leaders can also navigate the complexity of adopting innovations like artificial intelligence in health settings. The structural frame focuses on defining roles. For example, establishing an inclusive AI strategic planning committee involving faculty, IT expert, and students to decrease bureaucratic delays in dental schools. The human resource frame, on the other hand, focuses on employee well-being and training. For example, AI can support staff through automation of HR functions, freeing leaders to focus on the human part of leadership. Next is the political frame, which views the leader as a negotiator. Leaders must manage the fear of technology, replacing human roles while advocating for health equity and equitable access to expensive technologies. Lastly, the symbolic frame, which focuses on branding and values. Here, leaders should use websites and newsletters to celebrate wins and recognize the contributions of early adopters and donors. The primary benefits of information communications and technology in healthcare educational leadership encompasses improvements in clinical safety, operational efficiency, interprofessional collaboration, and patient accessibility. Reduction in medical errors is very important. IT systems can minimize medical errors by providing automated alerts and supporting the clinical decision making process through clinical decision support systems. Artificial intelligence can also assist in complex tasks such as reading radiology and histopathology images, which can process large amounts of data at speeds impossible for humans. Finally, closed loop safety involves informatic teams using technology to systematically analyze safety events, allowing them to close the loop on reported incidents and identify latent risks before they lead to patient harm. Additional benefit is the streamlining of management. IT revolutionizes healthcare administration by facilitating data driven decision making and simplifying complex administrative procedures. It can also help in workflow optimization. For example, digital tools can improve productivity by easing the workload of leaders and staff through more efficient scheduling, data review, and resource allocation. Finally, automation of routine tasks in which AI driven chatbots can automate human resource functions, freeing up managers to focus on employee well being and complex problem solving. It can also improve accessibility and patient satisfaction. Telemedicine and virtual clinics enable the provision of healthcare services across great distances, significantly increasing accessibility for remote populations. Mobile health and patient portals encourage greater patient engagement and higher levels of satisfaction in care received. IT also supports a massive reform in healthcare focused on care coordination through multiple professionals, ensuring that integrated care is delivered smoothly. Modern healthcare is delivered via multiple professional teams, yet care is often fragmented due to poor communications. ICT, therefore, is vital in interprofessional education for training students from different health fields to learn with and from each other. ICT supports digitally supported interprofessional communication and collaboration, whereby it increases the safety, efficacy, and accessibility of clinical information. It also facilitates task division. Technology allows for a better division of tasks and clearer definition of responsibilities among professional teams, including physicians, nurses, and pharmacists. Finally, online platforms like Microsoft Teams facilitate collaboration among dispersed teams, allowing for real-time consultation and interprofessional education. Finally, in education and leadership development, ICT can help in accessibility of training. For example, e-learning and blended learning programs can make leadership and management training more accessible and tailored to the needs of busy healthcare professionals. It can also help in curriculum flexibility, whereby the integration of technology in medical education enhances curriculum responsiveness to industry needs and improves student practical skills and workforce readiness. Digital technology also offers just in time access to information through cognitive aids like electronic checklists and manuals, supporting clinical leaders in complex decision making environments. However, despite the benefits that we have mentioned, health leaders still face significant hurdles in implementing and integrating technology in the health systems. First is human and cultural resistance. A primary barrier is faculty and staff resistance to altering traditional ways of working. Many individuals exhibit change aversion, preferring the status quo over the uncertainty of new digital workflows. There is also fear of technology, whereby employees often fears that Technology will replace human roles, which can lead to active or passive resistance during implementation. Finally, there's blame culture. In health contexts, a narrow or blaming perspective regarding IT errors where faults are attributed to user mistakes rather than system design can stifle the learning and reporting necessary for system improvement. Next challenge is informatics illiteracy. A significant barrier is the lack of formal training and knowledge in information technology among both clinicians and leaders. Also, many leaders rely on informal or on the job education rather than structured informatics training, which increases the risk of project failure. Finally, institutions can often suffer from inadequate onboarding education, leaving staff overwhelmed by the massive number of new applications they are expected to use. Another challenge, and very important one, is resource constraints. Limited financial resources and a lack of funding for both initial implementation and ongoing maintenance are major hurdles. System implementation often struggles against organizational pressures and competing initiatives that cause digital safety or training needs to be brushed aside. Failures often occur when systems are installed without adequate computational or network resources to support them. Next challenge is poorly functioning software, bad user interfaces, and a lack of interoperability between systems, which causes substantial frustration and stress for users. Rapid change cycles, whereby massive number of digital services and the speed at which they change can leave staff unable to keep up, leading to minimum level usage rather than full optimization. Finally, cybersecurity and privacy is a big threat and data protection regulations which can complicate system deployment. Leaders also often struggle with the difficulty of maintaining trust and social presence when managing remote or dispersed teams through digital platforms. Implementation often fails to poor leadership or a lack of informatics skill at the senior management level where technology is treated as a black box. And finally, communication gaps where a lack of clear definitions for roles and responsibilities within the new digital framework can lead to coordination failures. In summary, information and communications technology play a transformative role in the implementation of educational leadership and management within the health professions. Here are the following main benefits. ICT helps in facilitating data driven and efficient management. It helps in enhancing curricular quality and responsiveness. It helps in strengthening interprofessional collaboration. It improves clinical safety and quality. It allows expanding accessibility via e learning. And it drives innovation through leadership styles and boosts workforce readiness. And finally, optimizing human resource and capital through artificial intelligence. In conclusion, implementing ICT in health professions leadership is like installing a high-tech central nervous system into an organization. Ultimately, the role of ICT in educational leadership is to move health professions toward a knowledge society where data-driven decisions and collaborative learning are the norms. With that, I end my lecture. These are my references for further readings. Thank you very much for watching. Have a good day.